part of the latest Healthwatch Lincolnshire Talks With series, today I'm joined by John Turner. John Turner is the Chief Officer for both South and South West NHS Clinical Commissioning Groups. And if that wasn't enough, he is also the Senior Responsible Officer for Lincolnshire Sustainability and Transformation Partnership, the STP. This is part one of this interview, and we discuss an overview of current South and South West CCG work, for GP federations, neighbourhood teams, and we discuss the possibilities of CCGs and services in Lincolnshire working better and closer together. Could you give us an update on what you are responsible for as a CCG, and what are your priorities for the next 12 months?
Yes, of course. So perhaps it might be helpful to say that there are 4 CCGs within the county of Lincolnshire. There's East, West, South and South West, and I'm the Chief Officer for both the South, which covers the area Spalding through the Deepings and Bourne, over through Spalding and out to the Suttons, and for South West, which covers the area in and around Grantham and Sleaford. So the essential role of CCGs is we receive money from NHS England, the Department of Health. So our budget is allocated to us on the basis of the size of the population we serve, and it's adjusted for things like deprivation, rurality, the number of elderly patients. And our responsibility is then to use that money to commission or buy health services that best meet the health needs of the population, provide services to them, and improve their health status. So in effect what that means is not all, but the vast majority of healthcare that people in our patch get is commissioned on their behalf by us. So that's hospital services, community hospital services, general practitioner services, community nursing, mental health, so on and so forth. So when you hear nationally, the government is giving more money to the NHS or is requiring the NHS to meet certain targets or develop certain initiatives, then that tends to come to the CCGs, who then have responsibility for enacting it locally. In terms of our priorities, they are about trying to secure the best health services we can, the highest quality for the population, and improving the health of the population. In general terms, what we're trying to do, which is in line with national policy, is ensure that as many health services as possible, where it's safe and effective, can be provided to people in and around their local communities. That's been a sort of policy initiative for some time, and it remains a key driver for us, because we know that 90% of all healthcare is actually delivered in local communities at the moment, but there's much more we can do to expand services, improve diagnostics, have more surgical procedures being able to be done locally, but also to support the GPs and the community services to provide a more proactive support for the population, rather than just reacting to them as they present. So that's broadly the work of the CCG and our priorities. I think it's important to stress as well that we see ourselves as part of a partnership with others in terms of the work we do. So obviously we work in partnership with the hospitals, with the GP practices, with the mental health services and so on, and then we work in partnership with others, particularly social services and the county council, but also the district councils, patient representative groups, people like the Alzheimer's support, and a wide range of local groups. So it is a real team effort, isn't it, to support people and provide the best healthcare we can. One of the strengths of the CCG is that technically it's actually a membership organisation, and our members are the GP practices who work in our areas. So the key decisions are actually made by and guided by the senior GPs from across the patch. So they're very close, of course, to the needs of their local communities and populations. So we have to make sure, with their support and advice, that the way we do our business is very sensitive to the different needs of the populations.
Yeah, so what are there particular areas that you are prioritising sort of in the next sort of 12 months?
There's nothing particularly new that we're prioritising, but we are particularly looking to step up our efforts on a number of fronts. One of the most exciting developments that we're taking forward is the development of GP federations in our patch, along with the development of neighbourhood teams. So these are two separate but closely related pieces of work. So the current way in which GP practices work, as I'm sure you're aware, is there are individual GP practices across the patch. They happen to be their own businesses, and they have their own patient lists. What we know from other parts of the country is that there are many things that it is possible for GPs and their teams, and it's quite expansive teams working with GPs these days. There are many services that it's possible for them to provide, but not on an individual practice basis, but by sort of coming together across an area. They can provide a wider range of services. That's better for the population, but it's obviously better for GPs and their staff as well, because it could provide more interesting work and a shared resource, and it makes a lot of financial sense as well, because whilst obviously patients do need to go to hospital care is very expensive. So if it's possible to provide care locally, you can provide it arguably to better quality because it is local, provided by local staff, and also in a more efficient way for the service as well. We have GP federations working across South and South West. We've got three. So we've got the Lakeside, which is actually a super practice which works in Stamford, but also across into Northamptonshire. And then we have a GP federation in the South Patch. It's called the Alliance for Health for South Lincolnshire, and K2, which is the federation in South West. And those two work very, very closely together. So that's a really exciting development, and the potential for that to help do much more locally and more effectively is superb. And combined with that, there's the development of something called neighbourhood teams. And again, if you were to look at the way in which services in the community work, we have our GP practices, we have our community nurses, we have in some areas the community hospital, we have the community mental health staff, we have the local social care staff, and then we have a wide range of other local services in the third sector. Now, they're all working exceptionally hard, of course. There's a lot of demand across the patch, but they don't really work together in the way that we would all like to be the case in the future. We feel that if we're able to create a new arrangement for everybody to work together, not only will it be better for the staff and better for the patients, but we should also be able to identify those patients who might require particular proactive services. So, for example, for our elderly patients who are living in the community, I think it would be possible with this neighbourhood team approach to identify them more easily and provide better integrated services to them, so we can keep people safe and well in their own homes and reduce the potential for people to become seriously unwell and then require to go into hospital.
That seems like a really common sense sort of approach. Why has that not happened before now?
Sometimes, they say the one thing about common sense is it ain't that common.
No.
The reality is that the way in which the NHS has been organised hasn't been on a sort of partnership, integrated working model, but it has become somewhat fragmented in more recent years. Plus, of course, there's always been the difference between GP services ever since the NHS was set up. They have been their own businesses. That's the model, and other services which are funded and supported in different ways through different trusts and so on. So the organisation of services and the health bodies, I don't think has been overly helpful in terms of partnership and integration. But when you speak to healthcare professionals on the ground, they want to work in that collaborative, integrated way. More recently, the approach that government wants us to take is that of a much more joined up, systematic approach to service delivery. I think in simple terms, and I'm sure we will come on to this, the NHS faces some really difficult issues, and I think we feel quite strongly now that such are the magnitude of the issues we face that we can only address them by us all working together. So you're quite right, Dean. It's common sense.
So we're talking about integrated working and sort of working together. You mentioned earlier that we have in Lincolnshire 4 clinical commissioning groups. Do we really need 4? Are there plans to sort of merge these and so they work a lot better together?
There's a lot of really good work happening across the CCGs. We do have 4 in the county, serving the population 750,000 people in Lincolnshire. There are 2, I think, really important benefits of having a CCG, a local CCG. The first is that the members of the CCG are local GPs, local clinicians, and they are as I said earlier, they are closest to the communities. So it's really important because the health service has to be, I know it's a national health service, but we all think of it as a local service to us, don't we? That's what's most important. So it's really important that the way in which decisions are made reflect the needs of the local population across the patch. And also, I think equally importantly, we make decisions that are based on best clinical evidence and the guidance and our doctors indicating to us what they think is in the best interest. So it's, I think, really important that we keep that local focus. So we have the 4 CCGs, and at the moment we're very clear that we're going to retain the 4 CCGs. However, what we've been doing over the past 12 months or so is dealing with the downside of that, which is there hasn't been a county-wide arrangement for us all to work together on. So as well as keeping our local focus, the 4 CCGs are now working together across the county. So those decisions that we need to make at a local level, we're making at a local level. And those decisions which are best taken county-wide, we as CCGs together are taking those county-wide. So it's just about that balance. And one of the things we're actively working on at the moment is across the 4 CCGs, they each have their own executives. Okay. Technically, of course, in South and South West, I'm the chief officer for both, and actually I've got one executive team that serves both. But we're developing so that over the whole of the county, there will be, over the course of the next 6 months or so, there will be, we'll create one executive serving all 4 CCGs together. So again, it's, I think that's sensible. we'll make sure we get the balance right between keeping things local, but where it's better to do things county-wide, we will as well. Exactly.
Sort of smarter working. And,
yeah, I think that also it'll help our NHS trusts as well. So that's obviously United Lincolnshire Hospital Trust, the Community Trust, and the Mental Health Trust as well, because they operate by and large across the county. So if they're able to talk to the CCGs together about the county's needs, I think that can only be of assistance to them.
Brilliant. Thank you very much, John. What are you most proud of with regards to South Lincolnshire and South West Lincolnshire CCGs? The work that you've sort of carried out in the last sort of 12 months, what are you most proud of?
I think I'd say there's kind of three aspects to that. The first is in terms of the day-to-day delivery of services to the population. The staff in the CCG working with practices, working with hospitals, doing things together. We've been able to maintain and wherever possible improve the quality of care that patients get day in, day out. We know there are difficulties, for example, in A&E services, some aspects of mental health care, and some key standards around things like cancer care, for example. But I'm really pleased that we've been able to by and large maintain those standards, and I can see many individual pieces of work that have made a real difference to patients. And that's a long list, and some of the highlights you'd find in both annual reports. So that's one thing. The second thing is I'm really pleased with how closely we're working with GPs and their teams across the patch to support GP practices individually and help them to provide better care. So again, there's a long list of areas where we've secured additional investment in primary care services, additional premises are being built, so on and so forth. And the third thing I'd say is that within the CCG, as I mentioned earlier, we've brought two separate CCGs staff together into one team. So we've retained the two CCGs but one staff, and they've really come together to be a very strong and effective team, and I'm very, very proud of the way they've done that. And I know that that's a bit sort of behind the scenes, but as ever, you can't perform well as an organisation unless you've got well organised, well motivated and dedicated and hard working people. I'm delighted with that as well.
Thank you very much. Thank you.